According to the College of Dermatology, over 2 million people have taken isotretinoin. It's a drug used for the treatment of acne, and a lot of people know it as Accutane. How effective is it, and what makes a patient a candidate for Accutane?
So, one of the things so isotretinoin is the generic name. That's the name of the medication itself. And then there are various companies that make that isotretinoin, and those companies will brand the medication under different names. So Accutane is one of those types of isotretinoin. The reason that everybody kind of correlates or links isotretinoin with Accutane is because that was the original medication when it first came out. That's what it was called. It was called Accutane by the brand name. And so it's kind of the same way that people think of Kleenex tissues. Everybody says, give me a Kleenex. Well, Kleenex is a type of a brand of paper tissue, but there are many different types of paper tissues. Like, for example, Publix will make their own brand of paper tissues. Or the same thing is with when you go to make a copy on a copy machine, you say, let's make a Xerox. Well, the reason people say that is because the machines were called Xerox. They were made by the company Xerox, so everybody thinks of it as a Xerox, but it's not. So that's the first thing to remember, that isotretinoin, Accutane is a type of isotretinoin. Now, isotretinoin itself is a medication that has been found to help individuals that have severe acne, specifically what we call the nodulocystic type of acne, which is the type of acne that tends to cause a lot of scarring and a lot of problems for patients. So it's fortunate that we have this medication that can do that. It is a very good medication. It's very effective. It doesn't necessarily cure acne. What it does is it reduces the type of acne that the person gets, and it improves it so that they get less of the acne and maybe less severe forms of it. It's a medication that, although it's very helpful, it has side effects. Fortunately, most of those side effects are not common, but there is one side effect that's a very serious one, and that is that it can cause birth defects. So it cannot only can it cause birth defects if a person is exposed to it, if the baby's exposed to it when they're forming, it can also cause miscarriages and the death of the baby. So it's a very serious thing, and anybody who goes on this medication must be on at least 2 forms of birth control, and they must follow a very strict regimen in terms of how they take this medication. So there's a specific program called the iPledge program, and anytime a physician is going to put a patient on this medication, they must join this iPledge program in order to be able to get the medications. The program is basically an educational program and also a compliance program, which means that the patient needs to understand the risks of the medication, needs to understand that they need to be on birth control, needs to understand that they also need to take pregnancy tests, and that if they don't follow the instructions and the rules as it's outlined in that program, they cannot get the medication. Because the fact is that there have been babies that were born deformed or babies that died because they were on this medication. The medication also has other side effects. One of those is that it could affect the mental health of the patient, and that means that it can cause depression, and it can cause severe depression to the point that somebody can have suicidal ideation. In other words, that they can attempt suicide and commit suicide. Fortunately, this is not a common problem that occurs, but it is something so that we need to watch these patients carefully when they're on it. That's why they have to be on the special program, and they have to be monitored for any issues that could be a danger like that.